talk about why young and healthy individuals die of cardiac arrest if get infected with SARS-CoV-2 virus. As you all know, before they said that the most likely to be affected with the severe or critical symptom patients are people that are older of age, greater than 60 or 65, and also person who have an underlying comorbidity, who have underlying diseases like diabetes, cancer, and kidney diseases. And lately, there's a lot of data showing that young person also die of cardiac heart attack, cardiac arrest, and there's a lot of patients also who died, before they got these cytokine storms in their lungs, before they get having a hard time breathing, they die of cardiac heart attack, cardiac arrest, or myocardial infarction. And why is that? The public deserves to know why. Because some people might underestimate the severity of the virus. They think, oh, I'm young, I'm strong, I'm immune, I could fight the virus. That is not true. Be careful. The virus, this is a new virus. There's so much to learn. But based on my studies, the virus can infect and can kill young individuals, healthy with no comorbidity, no underlying diseases, and can die of cardiac arrests. And why is that? The virus, as previously discussed, enters into the body via ACE2 receptor, or angiotensin converting enzyme 2 receptor. It enters into our nostrils where there's ACE2 receptor. It can enter into our buccal cavity, and then can enter into our lungs and bind the ACE2 receptor in the type 2 alveoli. And once it binds there, it causes inflammations and autoimmune response, and eventually a cytokine storms where you cannot breathe because the lungs are filled with fluid due to your immune response. There's a cytokine storm. And then once the virus is leaves and infect another cells, it can go also to another parts of the body in different organs into the bloodstream, and particularly it will also infect the endothelial cells in your blood vessels. The endothelial cells in your blood vessels have also well expressed ACE2 receptor. Now, ACE2 receptor, this is what happened. Once the virus binds to your ACE2 in your endothelial cells, your endothelial cells will be inflamed. And underneath your endothelial cells, there is a coagulation factor called von Willebrand Factor. This von Willebrand Factor will be released into the bloodstream and will bind to your factor 8. Will bind to your factor 8 and cause coagulation. So you will die of heart attack because the blood clots in your system due to the inflammation of the endothelial cells, which has a well expressed ACE2 receptor. So that is the reason why the von Willebrand factor, which is synthesized or located beneath your endothelial cells of your blood vessels, once it is inflamed, it will be released into the bloodstream and then will bind to factor 8 and clot your blood. Now, one interesting science behind. If you are type A, type B, or type AB, not type O, you're type A, type AB, you are more likely to die of cardiac arrest or blood clot or thrombosis compared to type O. Why? Because type A or AB or B patients have a higher level of von Willebrand factor. So that is the reason why even if you're young, you are type A, once you get infected, you have a higher level of von Willebrand disease that will react to your factor VIII, causing a blood clot. You will die of heart attack. And I don't need to go in details for now. I will explain it later why ACE2 is very, very important in our body to protect us from underlying problem or protect us from the reactive oxygen species. So that's all for now. Thank you. So if you like to watch some more of my videos, you click in the links here and click subscribe and click the notification bell. Thank you very much. My name is Glenn Vale.